Bronxites are headed to the Bronx Library Center for a public hearing and press conference on the New York Health Act.
What we're doing today is we're doing a hearing for the New York Health Act. This is a piece of legislation that will create a single-payer system in the state of New York.
The New York State Assembly and Senate health committees hope to change structures within the current New York health system, structures that New York State Senator Gustavo Rivera finds to be an obstacle for New Yorkers.
The problem with our current system is that the decisions about healthcare are not being made by doctors and their patients. They're being made by insurance companies. And right now, the problem is that as opposed to thinking about whether you're going to get care or not, they're thinking about how they hold back care to make some money.
Hoping to make a change, Rivera explains the bill the New York State Senate and Assembly health committees hope to pass.
What this bill is going to do is provide health care to everybody in the state of New York, regardless of your age, of your gender, of how wealthy you are, or your immigration status. If you're a human being, you will get sick, you require medical care, and this bill would guarantee it.
This hearing happens to be the third in a series of statewide hearings, with the last hearing and conference for the New York Health Act scheduled in the Hudson Valley. Reporting for BronxNet, Kibben Aline.